Well, oncology pathways are being used increasingly. I will say that's not the dominant way oncology is being practiced today, but clearly there's a lot of increase there. And oncology pathways will more greatly standardize the way care is delivered. We find when there's standardization across the board, you have better quality and to some degree reduced costs. So all that sounds wonderful. However, oncology pathways are challenging to implement. Provider groups typically are the ones who are creating their own. Sometimes they're imposed or at least encouraged by the payers, very often encouraged and incentivized financially by the payers. But typically oncology groups are developing their own. I think the groups that do those successfully will be more successful. Payers will seek them out because they'll have more evidence of quality and cost effectiveness. That being said, as wonderful as the idea sounds, we've found that pathways in any field are difficult to scale, and that if an oncology group has a great deal of success with a set of pathways, one might assume they would spread like wildfire. Evidence is that that's not the case. So I do think oncology pathways and greater use of them is a positive development. I think that we'll see more payers trying to encourage them and more provider groups trying to implement them, particularly with the growth in ACOs. But I don't think they will be the dominant factor in oncology management over the next year or two.